Movement improves circulation. Movement supports joint health. Movement builds confidence. Movement increases capacity. Movement helps people return to activities that they enjoy. How movement affects recovery. So after an injury, a lot of times your first instinct is to rest. And that makes sense. For years, injuries were treated with prolonged resting. You were told to stay off of it, take it easy, avoid activity. However, today we understand something more important. Resting and prolonged resting can actually delay your recovery time. So that doesn't mean after an injury to avoid the pain, to push through things, but what it does mean is that movement plays a bigger role in your healing time and healing process. So today I'm going to explain why movement matters, how your body responds to movement, and why choosing the right movement for your body and injury is oftentimes the most important. The body is designed for movement. Let's start with a simple truth. The human body is built for movement. Every major system in the body benefits from movement. The bones, the muscles, the joints, the ligaments, the tendons, the nerves, cardiovascular system, nervous system. Movement isn't just something that we do. Movement is something the body expects. When movement decreases significantly, the systems in the body tend to function less efficient. That's why prolonged activity often creates problems of its own. What happens when we stop moving? So imagine a scenario where you sprain your ankle. You stop moving and you rest initially, and that can be a good thing. But let's pretend that you stop moving entirely for weeks at a time. What happens is your muscles are going to decrease, your joint mobility is going to decrease, your conditioning is going to decrease, your balance is going to decline, and your confidence is going to decrease. And your body's really good at adapting. The problem is that not all adaptations help. So the longer your inactivity is, the more difficult it becomes to move. Pain doesn't always mean stop. The number one biggest misconception about recovery is the belief pain automatically means damage. Sometimes pain can be a warning sign, absolutely. But pain is not always a measure of tissue damage. Think of a paper cut. It can hurt tremendously, yet at the same time, the amount of actual tissue damage is minimal. Now think of a bruise. Sometimes it's going to look terrible, but functions relatively well. Pain is influenced by many factors beyond tissue damage alone. This is important because for many people, they avoid all movement the moment discomfort occurs. And the result of that is decreased activity, less confidence, and slower recoveries. Recovery volume knob. One of my favorite ways to explain recovery is with a volume knob. Most people think of recovery as an on-off switch. Either you do everything or you do nothing. But recovery is actually more like a volume knob. The question is, how much should I be doing right now? Sometimes the answer is less, sometimes the answer is more. The goal is finding the right dosage. Too much movement could be problematic. A lot of times the sweet spot is right in between. Movement improves blood flow. One reason movement is valuable, blood delivers oxygen, nutrients, the building blocks used throughout the body. Movement helps distribute these resources. When people remain inactive for long periods, circulation often becomes less efficient. This doesn't mean exercise is magically fixing everything, but movement helps create the environment that supports recovery. Movement helps distribute these things throughout the body, and when people remain inactive, circulation tends to become less efficient. Joints need movement too. Most people think about muscles when they think about movement, but joints rely heavily on motion. Movement helps distribute the nutrients and resources that throughout the joint structures. When joints stop moving regularly, stiffness is going to increase. So most people feel this after a long car ride, a long flight, a long day of work, a long period of inactivity. But the body generally feels better with movement. This is often one of the most common overlooked parts of recovery. Movement doesn't just affect tissue, it also affects your confidence. Imagine someone hurts their back. They become afraid to do a movement, they start avoiding it, they're afraid to lift, they're afraid to move. The longer they avoid these activities, the scarier these activities become. Eventually, the body and the brain begin to associate these movements with danger. One goal of rehab is restoring the confidence of movement, showing your body that the movement is not dangerous, that it's not a big scary monster, showing the nervous system that certain activities can be performed safely and it's not going to cause damage. This process is incredibly important in the recovery process and oftentimes overlooked by many. The fear-avoidance cycle. A common pattern looks like this. Pain occurs, movement decreases, your strength decreases, your conditioning decreases, your confidence decreases, activity decreases further. Pain becomes more disruptive, the cycle continues. This is sometimes called the fear-avoidance cycle. The more someone avoids movement, the harder it becomes to return to normal activities. Breaking that cycle usually requires gradually reintroducing movement in a controlled and progressive way. Movement is medicine, to a point. You've probably heard the phrase, movement is medicine, and there's truth to that. But like medicine, dosage matters. Too much isn't always helpful. The right amount creates the best results. This is why individualized recommendations matter. What is important and appropriate for one person may not be appropriate for the other. A competitive athlete recovering from an injury requires a very different plan compared to somebody recovering from years of inactivity. The principles are similar, but the dosage is different. What about when it hurts? This is where people often become confused. They often ask me, should I move if it hurts? And the answer depends. Some discomfort during recovery can be normal, where some pain may indicate you're doing too much. The goal is appropriate progression. This is one reason that guidance can be very beneficial and very helpful for your recovery. The body often tolerates more than people think it can, but it also benefits from a thoughtful approach. Finding the balance is always key. You don't want to do too much and you don't want to do too little, and having somebody there to help you through that process to guide you is very helpful. Building capacity. One of the primary goals of rehabilitation is building and increasing capacity. Capacity simply means what your body can tolerate. Can you walk longer? Can you lift more? Can you sit longer? Can you exercise more comfortably? Can you perform daily activities more easily? The stronger and more resilient the system becomes, the greater your capacity becomes. And increased capacity often leads to fewer flare-ups and a greater confidence. What should you do if you're recovering from an injury? First, understand that rest and recovery are not the same thing. Recovery often involves movement. Second, avoid the all or nothing approach. Recovery isn't about doing everything or doing nothing. It's about finding the appropriate amount and looking at the gradual process. That's the last thing. Small improvements performed consistently outperform dramatic efforts that cannot be sustained. So finally, remember that movement is usually part of the solution, not always the enemy. My final thoughts. Your body is designed to move, and for many injuries and painful conditions, appropriate movements play a major role in recovery. Movement improves circulation, movement supports joint health, movement builds confidence, movement increases capacity, movement helps people return to activities that they enjoy. Recovery isn't always about doing everything or doing nothing. It's about doing the right things at the right time. Thanks for watching. Make sure you click like and follow, and I'll see you on the next video.